Hello, I'm Dr. Kodev, and this is Chapter 8 in your Martini Human Anatomy book. This is about the joints of your body and your skeletal system. So the basics, our bones are designed for support and mobility. The movements are restricted to the joints of the body. You might see it called articulations a lot in the different books that we're reading. So these joints or these articulations exist wherever two or more bones meet, and the bones may be in direct contact or separated by fibrous tissue, cartilage, or fluid. So we're going to classify the joints in mainly two ways, one by function and two by structure. So function is going to show us the range of motion. So synarthrosis, so without movement here. So this right here would be an example of quote unquote immovable. Again, these do slightly move. Okay? But as far as the textbooks are concerned, these are immovable, these sutures. Okay? And then we see amphiarthrosis, or these slightly movable joints. And a good example of that would be our spine. And so our vertebral bodies, these joints moving. So think about flexion, extension, rotation, and lateral bend of your spine. Diarthrosis, this is usually what we think of when we think of a joint of the body. These are freely movable. These are going to be your knees, your elbows, your hip, your shoulder, things like that. We're also going to classify it as structure or the makeup of the joint. So our synarthrosis, or these immovable joints, we're looking at sutures on the skull. Again, they are slightly movable. Bones are interlocked together via sutural ligaments, kyphosis, the teeth. Okay, so again, these can be moved, but they shouldn't be moved, right? The teeth, the fibrous joint between the teeth and the jaw. Periodontal ligaments of the teeth, synchondrosis being a cartilaginous joint within the epiphysis of the bone, binds the diaphysis to the epiphysis. So remember, this is the end of the bone and this is the shaft of the bone. Synostosis, bony fusion joint between two bones. So think of those 3 to 5 coccygeal bones. Okay. And here's an example here as well for us. So the sutures, synchondrosis. So this area here where the ribs, right, meet, but you will find movement here. Okay? So if you move your arms around and put your fingers right here, you're going to feel that move around a little bit there. Right? Gomphosis would be the teeth, and then the synostosis example. So syndesmosis, we're going to look at ligaments that connect two bones, but limit their motion. So think between the radius and the ulna, okay, and the tibia and fibula. So we'll see this kind of ligament here trying to stabilize these areas here, but it needs a little bit of movement. Okay. Symphysis, bones are separated by a wedge or a pad of cartilage. So think between the pubic bones or the two coxal bones. So we're seeing here this pubic symphysis right here. Diarthrosis, these are the freely movable joints. Again, kind of what we think of when we think of joints. So we're thinking shoulder, elbow, hip, knee. They're also called synovial joints, typically found on the ends of long bones. Diarthrosis would be freely movable synovial joints. All synovial joints have 6 basic characteristics. We're going to see a joint capsule. We're going to see articular cartilage, a joint cavity filled with synovial fluid, a synovial membrane, and accessory structures like cartilage, ligament, tendons, bursa, and we'll see a picture of what bursa are, and sensory nerves and blood vessels. Here is a nice view of a synovial joint, or this knee, okay, sagittal section, side to side. Okay, so you're looking at a lateral view. This would be the front of the knee joint because you could see the patella up here. Right? And it is up here. And we don't see it in between these bones like we might intuitively think that it is. It is higher up, just like it is right here. You can see this little bursa here. It's a little pad here, and they can swell. Same thing right here and right here. So you'll have these little bursas, and you might have heard of bursitis, inflammation of the bursa, right? And creating an issue with swollen pain, things like that. So here's the femur, here's the tibia, here's the patella. Okay, and what you can see over here in the bone, okay, medullary cavity in the middle, spongy bone out here, compact bone further out, okay, right in here. And then what you're seeing over here is the components of the synovial joint. So you'll see a layer called the fibrous joint capsule, another layer that's synovial membrane. You'll see the articular cartilage. Okay. And then the joint cavity containing synovial fluid in here. So this would have fluid in here. So diarthrosis are the freely movable synovial joints. We'll see that synovial fluid. And what is it doing? It's lubricating the surfaces of the articular cartilage. It reduces friction, nourishes the chondrocytes. Chondro, remember, is going to be cartilage. And so this is cartilage, and then cyte, CYT is the cell. So cartilage cells by entering and exiting the articular cartilage due to the forces acting on the joint. Okay, so kind of squishing the joint around. It acts as a shock absorber as well. Other shock absorbers, you'll see things like the menisci and fat pads. Okay, and then ligaments are connecting bone to bone. We're not going to get into each and every ligament, but I left the slides in here so you could see the vastness of the names of them, but we won't go through them all. And then tendons are muscle to bone, and then these bursa are those little sac area that I showed you right here, this little bursa, these little sacs right there. They can fill up with fluid. Okay, they're synovial tendon sheaths surrounding some tendons. And think of when your foot would develop like a blister and then turns into a callus, that ability to provide that kind of protection and shock absorption. And so it's not exactly like that, but you can kind of see the similarity there. So they can get irritated and swell up, right? And you could see it right here. And let's use another color so you could see it a little bit better. And these right there are little bursas, right? And you can see the little fat pads through here. So again, fat gets a bad name, but we need it for padding for different structures. And then the meniscus here, you might have heard of a torn meniscus. Think of it as similar to the discs, intervertebral discs between your spine. Okay, so the meniscus is going to give the same function here, basically. And then we see our ligaments connecting bone to bone here. Okay, you can see the synovial membrane here, the joint cavity filled with synovial fluid, and what we call the joint capsule itself. Okay, and the articular cartilage here. And good. Okay, so joint classification. Joint classification. We see these diarthroses, those freely movable joints that we're talking about here. So down here you can see a shoulder joint. Here you can see a hip joint. And one of the things we always want to remember about our joints is we are trading off mobility for stability. Okay, between strength and mobility. So the hip joint is going to be more stable but less mobile. The shoulder joint is going to be more mobile but less stable. Okay, and so it's always a trade-off between stability and mobility. Highly mobile joint is not very strong. A fairly immovable joint is really strong. Okay. The limited mobility reduces the chance of injury or dislocation. Okay, but we can still dislocate. Okay, but a shoulder more readily, more easily dislocates than the hip joint. So describing dynamic motion and structural classifications of synovial joints. So we're going to look at this as far as their types of movement, the axis of the motion, okay, and the type and range of motion. So our types of motion, we're going to see angular motion, rotation, and specific movement. So let's take a look. So angular motion, we're going to call this abduction and adduction. Abduction is moving away from the body part. Okay, so abduction, away from the body. Adduction is moving toward the body, and we'll see this in a moment. So add in, abduct, away. Okay. Flexion decreases the angle between the two bones. So think about flexing your knee or bending your knee. Extension increases the angle between the bones of a joint. Or think about from a bent knee, you'll straighten your knee, and that's going into extension. You don't want to go into hyperextension though. Right? We've done that before as an injury, probably at some point in time or another, and it doesn't feel good. Right? And it can damage the joint. Circumduction is going to be the circular motion. Okay. Rotation. So if you look left and you look right, right, you just rotated your neck. Okay. So moving the head in a no manner, okay, would be rotation. Medial and lateral rotation, or medial can also be called internal, lateral can be called external. And we'll have pictures for these. This will come to life in a moment. Rotating the arm outward at the shoulder is a lateral rotation. Rotating the arm inward at the shoulder is a medial rotation. We have pronation and supination. Okay, so hand in the anatomical position, which is forward, the palm forward. Okay, so anatomical position, that's going to be supinated. Then the hand rotates so the palm goes down. Okay, that's going to be pronated. So if you hold something in the palm of your hand, that's supinated. If you flip your hand over to drop it, that's pronated. So we see special movements like inversion and eversion, dorsiflexion and plantar flexion, lateral flexion, protraction, retraction, opposition, reposition, elevation, and depression. Okay, so just starting to look at what these words look like right now, and we'll go into it right here. So we start off with a neutral foot. Okay. If you turn your foot in, so the arch of the foot comes up, and you look at the arch of your foot from a seated position or standing position, you're inverting your foot. Eversion would be the opposite way. Okay. Eversion is the opposite. So eversion is going to be a fallen arch. Okay. Plantar flexion, you're going to point your toes. P for plantar flexion, P for point your toes. Dorsiflexion, you are going to lift your toes up. Okay, so put your heel on the ground, point your toe, that's plantar flexion. Put your heel back on the ground, lift your toes up, keep your heel on the ground, that is dorsiflexion. Lateral flexion, so starting from midpoint here, when she tilts her head straight down from her right ear or her left, this is her left ear to left shoulder without rotation, that's lateral flexion. So drop your ear to your shoulder, one side to the other, that's lateral flexion. Okay. Retraction and protraction are these jaw movements here. So you'll glide your chin forward and back, forward, and then retract it back. Opposition, so bringing the thumb to this pinky is opposition. So starting with the hand open and then opposition. Okay. Elevation, going up with the jaw, depression, going down with the jaw, or opening the mouth. The TMJ, so temporal mandibular joint. Okay, so TMJ, temporal mandibular joint. So what we want to see here is it consists of the condylar process of the mandible, that lower jaw, okay, and the mandibular fossa of the temporal bone, okay? T, M, and then J for joint. We see a lateral ligament, a stylomandibular ligament, sphenomandibular ligament. Again, we don't have to spend a lot of time on these. This gets very specific. So if you're specializing in something, you would look at this, but this is a general class, just an introduction to these terms and rhymes and reasons to them. And you can see right here. So here's the mandible, okay? And then this is the external acoustic meatus right here to give you an idea where you are. That's the ear hole. Okay, the external acoustic meatus is just the ear hole. Okay, so the ear would be right here. Okay, in your ear canal. Okay. Here is the zygomatic bone or that cheekbone. Okay. And then we see the different aspects of the jaw. And here's a good view of the styloid process. So it's long and skinny. Okay, and you could see the ligament here. So when you see these words, we don't have to memorize all these, like I said, but what you're going to see is this. You are going to see that there is a styloid process, okay? And then there is a mandible, okay? So here's your mandible, okay? So stylomandibular ligament is just this ligament here in between these two structures. Okay, that's what we want to learn. We don't want to necessarily memorize all these things. It's going to tell you where it is. Okay, it's going to tell you where these things are. And so then remember that sphenoid bone. Okay, so the sphenoid bone kind of deep in here. Okay, and so right there. Okay, so we're going to see that sphenomandibular ligament. Okay, that sphenomandibular ligament right here. Okay, that's the idea. So ligaments connect bone to bone. Zygapophyseal joints or Z joints for short. Okay, so zygapophyseal or Z joints for short. These are adjacent vertebra articulate at the superior and inferior articular processes, and adjacent vertebral bodies are separated by those intervertebral discs. Okay, and then we see the intervertebral discs are the pads of fibrous cartilage located between the bodies of the adjacent vertebra. So we've got the vertebral bodies here, and then we've got the disc in the center there, okay? Clean that up a little bit better. Shouldn't be sandwiched out like that. All right, so made of annulus fibrosus is the outer layer. Right? Annulus fibrosus is going to be the outer layer of that disc. And then a nucleus pulposus is going to be the inner layer. And this is easy to remember because the nucleus of the cell, right, was that circle inside. Okay. So these are going to look very similar to that. But it's not talking about a nucleus of a cell. It's just talking about the center part there. Okay. And then the vertebral end plate make up the inferior and superior surfaces, and they separate the individual vertebra and transmit pressure and load from one vertebra to the other. Okay, so instead of just bone on bone and the bone breaking, right, when you jump up, jump down, and move around, these vertebral discs are going to provide shock absorption for you. And here you go. So here's the nucleus pulposus right here. Okay, right in the middle there. And then the annulus fibrosus is on the outer ring of that. Okay. So nucleus pulposus in the middle, annulus fibrosus around that, and then you can see the end plate here. And then we're going to see a bunch of ligaments. So again, we don't need to know all of these, but you would, right? Because you'd look at this and you'd see anterior longitudinal. Well, this is on the front, anterior, and it's really long, right? Supraspinous ligament. This is the spinous process of the vertebra here, and supraspinous ligament is just going to be on that spinous process, okay, from bone to bone to bone, okay? Interspinous would be in between them, Okay? See, at first they're kind of intimidating until you just take a breath and play around with the words. So we see an anterior, right? We're going to then see a posterior, okay? And it's all the way along here, just like this is in the front. Okay, and then we see this little ligamentum flavum through here. And what do we see here? We see the IVF, or intervertebral foramen. And what comes through there? The spinal cord is through here. You could see it in yellow right here. And then the little spinal nerves come out of these little holes here, the IVFs. Okay. And here are the ligaments here. If that's of interest to you, feel free to pause and check out all of the different ligaments. An interesting picture here for you as well. Again, here's the spinal cord. Okay. So vertebral movement. So flexion is when you bend forward, try and touch your toes. Extension, try and do a little bit of a back bend. Lateral flexion, go straight to the side. Okay. Rotation, you're going to twist your back, okay, to the right, to the left. Shoulder complex consists of clavicle, scapula, humerus, sternoclavicular joint, shoulder joint, and all of the different ligaments. So again, all you would do is look at the word parts. Costo means rib, clavicle, so between the clavicle and the rib. Okay. And you can see here, there's a little disc right here, little articular disc. Okay, so you can move your arm around. If you raise your arm and wave while gently palpating right here, just kind of hanging onto it, you might feel a little movement. You might feel a little restricted movement. You might feel a little excessive movement, depending on the health of that joint. Or it might just be perfect, right? And here's your clavicle or your collarbone. Okay. And here's the manubrium of the sternum. Here's the second rib. Here's the first rib. So the first rib is underneath here. Subclavius is that little muscle. See the word sub? Under. Clavius telling us clavicle. So it's this little muscle under the clavicle. So shoulder joint is going to be our glenohumeral joint. It is a ball and socket joint, just like your hip. We're going to see the femur and the hip bone, okay, as another ball and socket joint. So the glenohumeral at the shoulder, the articulation of the head of the humerus with the glenoid cavity. We're going to see the glenoid labrum covering the edge of the glenoid cavity. Then we'll take a look here. So here is your humerus, right? And then here is the glenoid cavity that it sits in. So we've got the humerus, right? And then we have a little bit more, right, of the head of the humerus here. And then where it sits in there is just going to be the cavity there. Let's see a better picture, shall we? I saw one in here. Right here. Okay, so head of the humerus is in green here. And then this little shallow depression there is the glenoid fossa. Great. So you can see all of these, and you can take a look at this. You'll see it in your lab manual as well. And you can see the scapula here, the little coracoid process here, and then the clavicle here, and the acromion coming around from the backside there. Shoulder joint, we see the skeletal muscles and tendons. So the muscles of the shoulder joint that stabilize it are called the rotator cuff. And we saw those we'll see that in our muscle, right? In our muscle chapters, and they're called the sits muscles: supraspinatus, infraspinatus, teres minor, and subscapularis. But we don't have to know that specifically yet, but you will, and you'll get there. And those are the rotator cuff muscles that are stabilizing our shoulder joint for us. We have bursas all over our body, right? So inflammation of the bursa can result in what we were talking about, that bursitis. okay? And that is this right here. So see the little bursa or these little sack or like the gelin in our shoes. Remember the gel in our shoes, those commercials for gelin, right? And so we see these little areas of increased friction, right? And we need a little support in these areas so it doesn't get damaged. Okay. Elbow joint, this is a hinge joint. So if you flex your arm, okay, activate your bicep, you're going to see that hinge. Okay. Articulation between the humerus and the ulna and the humero-ulnar joint. The articulation between the humerus and the radius is the humeroradial joint. And then the associated ligaments. You could see here, they kind of look like spider webs, right? Really just stuck there to try and stabilize these areas, connecting bone to bone and trying to create a little bit of stability here. It's a radius and ulna, okay, radio-ulnar joint. We have a proximal, which is in proximity to or closer to the midline of the body, and then distal is further away, okay? And you can take a look here. There is a big interosseous membrane here. A lot of connective tissue between this radius and ulna. Okay, between the radius and the ulna here. Joints of the wrist, or you might hear your wrist called the carpal area. Okay, so we see the radiocarpal between the radius and the carpal bones, and we're also going to see intercarpal joints and all of the ligaments connecting these. So see right here, so many ligaments here, right? So many ligaments here, and it's designed to help stabilize these little bones or your carpals. You might have heard of carpal tunnel syndrome before. Okay, so that is an impingement of the median nerve here at the carpal tunnel. Okay? But these are the carpal bones, and we'll look at these. Okay, and so we see the scaphoid, we see the lunate, we see triquetrum, we see pisiform, we see trapezoid, we see trapezium near the thumb, okay, and capitate and hamate, okay. So joints of the hand, so our carpal metacarpal joint. Okay, so our carpal metacarpal, intracarpals, metacarpal phalangeal, interphalangeal, a lot of crazy words. Phalanges are just your fingers. Okay. And your carpals are those bones, the scaphoid, the lunate, the capitate, so on and so forth. And then your phalanges are your fingers. Okay. And in between there, okay, are the metacarpals. So between your carpal bones and your fingers, okay, are going to be your metacarpals. All right, let's look at the hip joint. It's a ball and socket joint. It consists of the head of the femur, the acetabulum, and this articular capsule. This capsule is deep, it's strong, it's dense, lends itself to great stability. So it's that shoulder joint versus hip joint concept, right? We're trading off mobility for stability. The hip joint is going to be more stable, less mobile. Okay. And so what you're seeing here, right, up, down, okay, front, back, and we see this acetabulum in here. Okay, so in the ball and socket, this is the socket. Okay. So iliofemoral ligaments, pubofemoral ligaments, so pubic bone to femur, ilium to femur, ischium to femur. And that's all that that's telling us for these things. And it's just all of these connectors here. Okay, stabilizing this hip for us. Okay. So you can see a dissection here. So here's the femur head. And then above that would be the acetabulum. Okay. Greater trochanters out here. And you can see an x-ray here So we could see the head of the femur here. And then the acetabulum is up in here. The acetabulum up a little higher there. And then femur head. Good. Knee joint. So the articular capsule extends from the distal femur to the proximal tibia. This includes the patella, which is your kneecap. Okay. And it's made of medial and lateral menisci and fat pads. So these are cushions. Think about those menisci like you kind of think of the intervertebral discs. Okay, same kind of concept there. So they act as a cushion, conform to the shape of the femur as it changes position, increases the surface area of the tibiofemoral joint from tibia to femur, and provides lateral stability for us. Fat pads help the bursa reduce friction between the patella and other tissues. And you can see all of the ligaments here. Okay, so we'll see this ACL is a very commonly torn ligament. Okay, and here's a couple more ligaments connecting bone to bone. Okay, and quad tendon here supporting as well. And you could see all of these different areas here. So again, feel free to pause as we go through these, or read along in your book, or go through the lab manual. There's a lot of depth to these lessons though. So you have a lot of access to a lot of these different things. So the knee joint, locking in the knee, extending and rotating the knee in a manner causing tibial tubercles to become stuck in an intercondylar notch in the femur. So this mechanism stabilizes the knee joint and permits standing for long periods of time, or this bone stacking, right? Or other actions without tiring the extensor muscles. And then flexing the knee can unlock it. Ankle joints. These are also called the talocrural joint, tibia and talus. Okay, tibia and fibula. Tibia and fibula. Right? Fibula and talus. And then the deltoid ligament is not up at your shoulder, like you would think the deltoid muscle, but it connects tib to the little bones of navicular, calcaneus, and talus on the medial side. Okay, so we see other ligaments here. And here they are. Look at all those ligaments over through here. Right? So it looks like little spider webs, like Spider-Man came through and just threw his spider webs here in order to try and stabilize. Right? Good. So joints of the foot in between the tarsals. Okay? So intertarsal joint, tarsometatarsal, metatarsal phalangeal. So phalanges are not only your fingers, but they're also your toes. Okay? So fingers and toes. And here you go. Okay, so we see all the different bones of the foot here. Okay, so you see the calcaneus, this is our heel. Okay, you can see the navicular, which means boat. Okay, so it looks like a boat. And then cuboid right here, cuboid bone. And we have our cuneiforms right here. Okay, so our cuneiform bones, these bones right here. And then our metatarsals, let's go for here. 1, 2, 3, 4, and 5. 1 is going to go for your big toe. Okay, that's your first metatarsal. Okay, and then we've got our phalanges. Okay, there you go. And rheumatism is something that they kind of lump into this term rheumatism, this pain, stiffness affecting the skeletal system, muscular system, or both. And then arthritis is just inflammation of a joint. Okay. All right, and that is our chapter 8 for this lesson here. So I will see you for the next chapter.